We'll begin in 1 minute. Call the meeting to order. Please stand for the Pledge of Allegiance. Third session of your Brookings City Council. Ask City Clerk to record attendance.
Mayor and council members, when I call your name, please respond with present. Bacon,
Present.
Brink,
Present.
Collins,
Present.
Corbett,
Present.
Niemeyer,
Present.
Tilton Burn,
Present.
Wendell.
Present.
All right, thank you. Council, first item is the consent agenda. Entertain a motion to approve the consent agenda.
So moved.
Second.
Any public comment? Seeing none. Council comment, questions? Please call the roll.
Collins,
Aye.
Corbett,
Aye.
Niemeyer,
Aye.
Tilton Burn,
Aye.
Wendell,
Aye.
Bacon,
Aye.
Brink.
Aye.
Consent agenda is approved. There are no items removed from the consent agenda. Before we begin the open forum and presentations, reminder anybody that was here the last meeting knows that one of the things we've emphasized is we really want to hear from people, especially tonight. We have a number of ordinances and resolutions. I think it's important that the council hear from the public. But to ensure that everybody has that opportunity, what we're doing is limiting it to one person can speak one time, but also for 3 minutes. You'll notice that little box right up on top of the podium. You start speaking it, the green light comes on. At 1 minute, the yellow light comes on. And at the end of 3 minutes, when your time is up, the red light turns on. And that just gives us the opportunity. Also, when somebody's speaking, please be respectful for everybody. Whether you agree with them or not, they have a right to be heard, and it's important that we do hear them. And so after every public comment, then the council has the opportunity. Please afford them the same opportunity. So at this time, City Manager, I turn it over to you for a recognition.
I guess, Todd, will you join me up front here? So for those that are watching at home, we have a process here in the community of Brookings where we always recognize our newest management and our department heads. And it's an opportunity for the citizens and our council members to meet the newest members of our management team, because they get to see them a lot of times here presenting to the community, and they get to see them in their work environment, especially if they go out to places like the landfill. Todd here is our landfill director, and he's been with the city for 35 years. 27 years of that he's been actually at the landfill. He started out in the finance position here with the city of Brookings, and Todd has done an exceptional job with the finances of the landfill, and I can tell you that he's leaving at the end of this month, and the landfill will be in great financial position. Part of what Todd does day in, day out is constantly looking to understand how we can expand our services here at the city and make things better. Over his tenure, he's done things like adding automation to our collection system, also increasing our recycling and our composting process. Here just most recently this last year, we added the brown carts so that citizens can add more grass clippings and we can improve that composting process and services to our citizens across the community. Here this last year, 2019 and 2020, Todd was recognized for his career achievement from the South Dakota Waste Management Program, a recognition that isn't given out that often, but we're really happy for Todd and to be recognized for all the work he's done. As city manager, I've gotten to know Todd here the last 2.5 years, and I can tell you it's been a fun ride, and I truly appreciate the efforts that Todd and commitment that Todd has to this organization, but more importantly, the community as well, and his employees. Todd, want to give you a certificate of appreciation for all that you've done with the community, for the community of Brookings and for this organization. Thank you for your years of service to this organization. Take a quick picture. And would you like to say any words, Todd?
Yeah, it's been quite a ride. I guess I'd just like to thank all the councilmen I've served under, city managers, and more important, the residents of our community. They're the ones that make all this happen for us. And I'll still be around a little bit. You'll see me once in a while, but I appreciate everything you guys did for me. Thank you.
Thanks, Todd.
I just have to add a story about Todd. He, remember all Y2K? We were all worried what was going to happen to our computers, and so he stayed and managed or babysat, if you will, the computers that whole night to make sure there wasn't a problem. So that's the dedication he's got. So Todd, thank you so much. Okay, I'd ask Christina Krogman and her group from the Brookings County Child Protection Officers to join me down front, please. All right. So, mayoral proclamation, and by the way, thank you for all that you do. So very, very important. And I know Nikki Eining's got a little sick one tonight, so she couldn't join us. So, but we do appreciate all you're doing. So, and whereas children are vital to our state's future assets, our successes, our prosperity, quality of life, as well as being our most valuable asset. And whereas all children deserve to have a safe, stable, nurturing home and community, they need to foster their healthy growth and development. And whereas 1 in 4 women and 1 in 6 men were sexually abused before the age of 18, and whereas child abuse and neglect in a community responsibility affecting both the current and the future quality of life of our community. And whereas communities that provide parents with support, knowledge, and concrete resources they need to cope with stress, nurture their children, ensure that all children grow to their full potential. And whereas child abuse prevention strategies succeed because of the partnerships created among citizens, organizations, schools, faith communities, healthcare, all of our providers, our law enforcement, and the business community. Now, therefore, I, Keith Corbett, Mayor of the City of Brookings, South Dakota, do hereby proclaim April as Child Abuse Prevention Month. And I call upon all of Brookings to increase our efforts to support families and thereby preventing the serious issues of child abuse and strengthening our community. Thank you for what you do.
Thank you so much.
Okay. Anybody want to speak? Christina, you want to say anything? Or?
I'll just say a little bit. I just want to thank you, City Council and the Mayor, for recognizing Child Abuse and Prevention Awareness Month for April. Child protection, the Brookings County Child Protection Team has been in operation for many, many years, and we are so fortunate to have many stakeholders, community members that care about the children of our community and in county, and we appreciate you, Mayor Corbett, in remembering us, so thank you so much for this. We really appreciate it.
Thank you. Now maybe I could get the Brookings Disabilities Awareness Committee to come up. Brianna, Doran, Matt Weiss, and Mark Sternhagen. He never gives up, does he? Okay. So whereas individuals whose disabilities occur during their developmental years frequently have severe disabilities that are likely to continue indefinitely. And whereas disabilities is a natural part of the human experience that does not diminish the right of individuals to enjoy self-determination and experience full inclusion in our economic, political, social, cultural, and educational mainstream. And whereas family, friends, and the community can play an important role in enhancing the lives of individuals with disabilities, especially when providing with necessary services and support. And whereas the goals of the nation, state, and community properly include providing individuals with disabilities the opportunity and support to achieve full integration into society in an individualized manner consistent with unique strengths, resources, priorities, concerns, abilities, and capabilities of each individual. And whereas through increased awareness of programs and activities, the public will better understand the potential and needs of individuals with disabilities. Now, therefore, I, Keith Corbett, Mayor of the City of Brookings, South Dakota, do hereby proclaim March 2021 as Developmental Disabilities Awareness Month. And I call upon all the people in Brookings to join their fellow citizens and community organizations in recognizing this special observation. Brianna, you gonna say a few words? Yeah. Right.
All right, and Matt's going to join me as well. Okay. Good evening, and thank you, Mayor and Council. My name is Brianna Doran, and I am the chair of the newly named Disability Awareness Committee. I spoke at previous meetings advocating for the passage of our name change to further elevate our purpose in the community to bring awareness to individuals with disabilities in Brookings. And on behalf of our Vice Chair, Matt, and Publicity Coordinator, Mark, who I have with me, and our committee, we thank you for recognizing the importance of decreed support for individuals in our community.
With this proclamation, we want to take a moment to raise awareness about the inclusion of people with developmental disabilities in all areas of community life, as well as continue to address the barriers that these individuals may still face.
And I'd be remiss if we did not mention that this pandemic has disproportionately affected this high-risk group, and moments where these individuals are given recognition, celebration, and a listening ear can be critical. The Disability Awareness Committee thanks the City of Brookings for their continued commitment to not only statements of inclusion, but followed action to make a positive difference and raise the quality of life for individuals with disabilities. So thank you again. And Mark has some words as well. One more.
It's extra important this year that we recognize this month as Developmental Disabilities Awareness Month. This last year has been especially hard on many developmentally disabled for a lot of reasons. One, they're more likely to have lost their employment, but also many of them fall in the high to very high risk groups. And they are some of the people that need to be protected. And so they've had to be sequestered even more. Plus, they have the added disadvantage of not being able to understand it. And so it's been much harder on them. So I think it's very important that we think about that, and that this month that we take extra time and think about the people who really don't have a choice. And they are what they are. So, and I want to say something on a very personal note. As many of you know, or if you don't know, I had polio. The reason that I got polio was the vaccine was in short supply, so I was not able to be vaccinated. If I had been vaccinated, I would not have gotten polio. There is no doubt about that. So please, if you get the opportunity to get the COVID vaccine, please don't hesitate. Take it. Get the vaccine. It's our only way to normalization. Thank you. And I guess I'm taking this chair with me. There you go.
Okay, do we have someone here from SDSU for the SDSU report? There we are.
Good evenings, members of the council. I am Emily Toms, a senator at large for SA, and I'm happy to be here tonight on behalf of the South Dakota State University Students Association. Tonight, I have the following updates for you. First, an essay recap from the last 4 weeks. Our election officially began today at 8 a.m. and will conclude tomorrow at 5 p.m. We have both a contested presidential election and 25 candidates for our senatorial race. Our next Senate will be sworn in on April 12th. The Students Association approved an agreement with the Miller Wellness Center to provide access for students that are enrolled in the summer to the facility for students that are enrolled in the fall to access the Miller Wellness Center in the summer for no additional cost. This should bolster efforts to make Brookings a year-round home for students. Additionally, our Student Promotion Fund Committee has also began processing an application for the Little International Livestock Show and will likely receive the Hobo Day application before the end of the academic year. For university updates, we have the following. We launched the Spring Back Healthy campaign to encourage student COVID testing upon our return to campus. And Governor Noem signed the Freedom Scholarship into law last week, a signing attended by our very own President Seaton. This concludes my report. Thank you for your time. I will stand by for any questions.
Any questions? Zebediah does he pay you to do this, or is he just kind of shirking it?
He does not, but I was happy to proxy tonight.
Okay. Anybody have any questions?
I was just going to ask, you mentioned a contested presidential election, just votes are close, or?
We have not heard anything yet, but as far as I know, both sides have run very competitive campaigns.
Thank you for the update.
Any other questions? Okay, thank you.
Thank you for your time.
At this time, we'll open up the open forum. As a person may speak to a topic that's not on the agenda tonight, and or a brief announcement or invitations. It have to be very brief if you have 3 minutes. So anyone care to speak to the open forum? Okay, seeing none, close the open forum. This time, contracts and change orders. I'd call on Community Development Director Mike Struck.
Thank you, Mayor and council members and members of the audience. We got an action item before you tonight, potential discussion, possible action on an amendment to a development agreement associated with tax increment district number 8. And specifically, the developer is requesting an amendment. We had a clause within our development agreement that after 2018, the sale price of the lot and home combined could not exceed 80% of the South Dakota Housing Authority's first-time homebuyers program, which currently that figure is set at $275,000. So with the 80%, that restricts that total sale price of the home and lot to roughly $220,000. In the past year, they have seen some pretty significant increases in lumber prices and such, and they're requesting the removal of that 80% limitation and just move it straight to the $275,000 mark. I want to remind you that this area is in a TIF district, and so the developer is basically receiving a public subsidy in the property tax increment that is generated from this development. And so the development in itself is already being somewhat subsidized. When this is something that's certainly up for your discussion. We've discussed it internally amongst staff. It would apply to 10 residential lots. There's 42 residential lots total, but 32 of them have been restricted to the Interlakes Community Action Partnership. And then the other 10 would be available to ICAP, Habitat, or if neither one of those two organizations have the funding to purchase the lots, it can go on the private sector. And so this would really apply to those 10 residential lots that would be available to the private sector to acquire those lots and then develop. So at this time, the staff is recommending that we would be comfortable with bumping up that price due to rising lumber costs to a maximum price of $245,000, and we'd stand for any questions that you may have.
Why don't we get a motion on the floor if that's okay, Leah?
Yep.
Do we have a motion?
Motion to approve.
That's a motion then. All right, do we have a second? Okay, motion and second. Any questions for Mr. Struck?
I was just going to ask the question so that if I'm understanding this correctly, the recommendation to 245,000, that would be 80% then of
We would just eliminate the 80% rule and just have it capped at $245,000 for those 10 lots that would be available. And then basically with whatever direction you provide, we'd work with the city attorney to draft up the appropriate amendment to the development agreement with those provisions as you determine this evening.
Councilman Wendell?
Did you select the 245 number just to split the difference between the kind of 275 and 220? Their 220 was their request, correct?
220 was the original, and they proposed to just move it straight to the first-time homebuyer program at 275. We felt because with the TIF, they're already receiving a certain level of public subsidy for the infrastructure, the water, the sewer, the storm sewer, the streets that were in place. And so we didn't feel that it was completely fair to go all the way to the 275. There's other homes that are currently being developed by the private sector in the 260 range. So we felt that because we were trying to target workforce housing, it still needs to maybe be a little bit lower than what the market is providing. The 245 is close to about 90%.
Are they even able? That's my concern, that the costs have gone up so much.
There is some questions on that. In mind is they're being subsidized on the lot price. The lot price can't exceed $29,000.
And that's part of this 245, or that's in addition to this?
That's part of the 245.
Okay.
So, roughly figuring is they're receiving a subsidy in the amount of about $15,000 to $20,000 per lot. So if you were to attack that on top of the 245, now you're in that 260 to 265 range. So we feel that with the current subsidy that they're receiving from the TIF, 245 is, kind of probably an appropriate mark to try and target for affordable housing.
Okay, thank you.
Any public comment? Yeah, why don't you come up and want to make sure everybody sees you.
Ricky, I just wondered what would happen if timber prices go down in the next year. Would this maintain, or would you roll it back?
We did discuss that, and I'm glad to see the lights not blinking on me. That is something that you could certainly incorporate into this amendment, that should prices go back to 2019, 2020 type figures pre-COVID, that it certainly could be reevaluated. And that would be something that if you choose to include in the amendment, we'd so entertain. We just worked with City Attorney Brightsman to make sure that we draft this ordinance or this developers agreement amendment appropriately to take into account your desires.
Councilmember Brink?
And the amendment that's in our packet would be this proposed language for this?
The amendment in your packet is simply the two sections that we would need to amend. I think it's sections 3 and 4, and that references the 80%. We would strike out that language, and we would seek your guidance on what would be the appropriate language or amount that you'd want to insert in that place. And it may require some additional wordsmithing as far as removing the South Dakota Housing Development Authority if we go with a specific dollar amount.
Council, any other questions?
Mayor Corbett?
Yes, Councilmember Tilton Burn.
I'm just curious if we happen to know, the guidance is really that the home cost should be about 30% of a household income in order for it to be affordable. Do we happen to know what the annual income of a household would need to be in order to reach that $245,000 given current loan circumstances? I apologize for not having done this math ahead of time, but I'm wondering if we know what that average is right now in our community.
Unfortunately, Councilmember Byrne, we did not do those calculations either.
Okay, thank you.
Any other questions, council, comments? Lonnie, please call the roll.
Corbett,
Aye.
Niemeyer,
Aye.
Tilton Burn,
Aye.
Wendell,
Aye.
Bacon,
Aye.
Brink,
Aye.
Collins.
Aye.
Okay, that's approved. Okay, now we'll go into first readings. I don't see Eric, so Ashley, are you doing this one? Okay. Covering for him again, aren't you?
Good evening, Mayor, members of the council. This is the first reading of ordinance 21-8. It's an ordinance authorizing supplemental appropriation number 3 to the 2021 budget. This ordinance has 3 parts. Part 1 will redistribute the 2020 third B and bid tax surplus to the supported economic development agencies. This will be a total of $84,729, and as you can see, it's split between the Chamber of Commerce, the Convention and Visitors Bureau, the SDSU Student Visitor Promotion, the Brookings Economic Development Corporation, and the Swiftel Center, as well as the Research Park. You may remember that these organizations sustained funding cuts of about 15.3% across the board in 2020 to prepare for the uncertainty of the COVID pandemic, and revenues for the year turned out better than expected. So the city staff is recommending a redistribution of 41.3% of those original cuts. Moving on, part 2 is an increase to the CIP expense authority by $358,616.77. 20-9 and 20-14 last year approved the purchase of a fire truck and the loan from the landfill to the CIP fund to pay for it. There is currently $190,000 budgeted in the CIP fund for this truck, and the amendment would provide for the remaining $350,243 to finalize the purchase of the truck in full, as well as the additional $8,373.77, which covers this year's interest expense to the landfill. The CIP fund will pay back the landfill over 6 years at a 1.55% interest rate. And finally, our part 3 will increase the funding to cover initial efforts to prepare for the implementation of the medical marijuana legalization bill, which is set to be effective on July 1st. City staff is requesting a budget increase of $30,000 to be funded by the general fund's unassigned surplus. And the second reading of this ordinance will be on April 27th, and I'd be glad to answer any questions you have.
I failed to mention at the beginning on our first reading, we don't vote on it, but it's for Ashley?
Maybe this is more
Yes.
for you, Paul, but the note for the funding of a consultant in that part 3, can you explain a little bit about what that would do for us and what the methodology would be for selecting that?
Sure, it's actually just a plugged-in number, and we have no idea what it might truly cost or if we'll utilize the services. With the legislators' lack of action this last year, the bill will actually go into place July 1st of this year. We anticipated that we would have time until next November 2022 to enact zoning, permitting, laws for the municipality. Now we have about a month or 2 months to really gear up for this process, knowing that we are very have a lot of things on our plate currently. We thought it'd be prudent to potentially have funds available should we have to hire a contractor, such as an additional attorney for legal advice or someone to help us throughout this process. We are made aware that there are maybe potentially a new or a special session that may occur at the beginning of May, so this could be all for naught. But at the same time, we'd like to make sure there's some funds there just in case we need to tap into it.
Thank you.
Any other council questions? Any public comment or questions? Okay, thank you, Ashley. Okay, ask Chief Building Official Jared Thomas. There he is. Jared's going to speak to ordinance 21-009.
Mayor, member of councils. Let's see. Ordinance 2109 or 009 is a ordinance that would amend Chapter 22 of the Building Code, as is periodically required by state law. City staff, along with the Board of Appeals, reviewed existing building code and amendments, and compared that to the 2018 I-codes. and have prepared updated amendments and are looking to, I guess we would recommend approval as presented. So I can stand for any questions that you may have.
Any questions? Councilman Brink?
I noticed in reading this that some of the measurements were modified by us for the purpose of this building code, like maybe the 2018 would have said 44 inches and we're proposing 48. I saw that repeated in a few different ones. I just was wondering, conceptually overall, is our adoption of this proposal, would our version of this be more restrictive than the 2018 building codes on a whole, or less? Are we trying to make it easier for people to comply?
Yeah, specifically with the 48-inch, the measurement you're referring to, the building code requires a 44-inch. With the way that buildings are built, foundations, a 4-foot wall, actually to get a window to meet the 4 foot, you actually would end up blocking out that foundation. And so this amendment was done years ago to 48, and that just accommodates the ability to build a 4-foot wall for like a split foyer style house without having to do that additional blocking. So that's the intent behind that.
And is that our directed change, or that was something?
That was something that was done by previous City of Brookings staff. That was an older amendment that, and part of this process when we went through the amendments, because they were new to me, this is my first code change since I've been here, is we went through all the amendments, and I asked a bunch of questions like, why do we have this? And so I tried to get a pretty good history and understand why we had some of those, and that was one of them that came up. So
You basically pulled all the amendments that we'd made previously,
Yep.
pulled them up into this version.
Yes. Yep.
Okay, thank you. That was what I was
Yep.
getting at.
Any other council questions? Any public comment or question? Okay, we'll have a public hearing on April 27th.
Thank you.
Thank you, Jared. I'm going to turn over to the city manager for public hearings and second readings.
Thank you, Mayor, City Council members. At the March 16th City Council meeting, the Resolution 21-24 was tabled. The resolution transitions the COVID-19 ordinance into recommendations. If approved, this action before council will make the mask mandate and occupancy requirements into recommendations. Staff does recommend taking this off the table and then tabling it again until April 30th. Just for a quick update for Brookings County, we currently have 95 active cases. There are no occupied hospital beds for COVID-19. According to the hospital's dashboard, our current rate for positivity is at 7.2, which is just a slight increase from the last update. Brookings County has lost 37 lives, which isn't an increase from the last report, and we are still in substantial spread. We do have Daniel Scholl with SDSU that would like to give a quick update to City Council. Then we also have Bonnie Specker and Patrick Seedling from Avera that are available for council if you should have any questions of those two individuals.
Dr. Scholl, you prepared to speak to this?
Yes, Mr. Mayor, thank you very much, and members of the City Council. My name is Daniel Scholl. I'm Vice President for Research and Economic Development at South Dakota State University. When we had the opportunity to speak with you at your study session last week, I was happy to report that SDSU had reduced to a COVID-19 safety level of yellow from orange, and that was driven largely by the community, the county, moving into the category of moderate spread. Since then, the data have necessitated that the county be reclassified as substantial spread. And after carefully considering the data and the ramifications, yesterday afternoon, we decided to return to safety level orange, one notch up. The implications for that are that travel is again restricted to mission essential travel. External events, the maximum capacity for external events is returned to 60 from 120. And virtual interactions, even on-campus meetings, are highly encouraged. We thought that it was important to communicate this to the council as you're considering changes, and as we continue to work hard to reach our goal of providing a face-to-face commencement experience for our students in May. I'd be happy to stand by for any questions about these data or other aspects of SDSU's management responses to the pandemic. Thank you very much.
Thank you, Dr. Scholl. Council entertain a motion to remove this from the table.
So moved.
Second.
Okay, we have a motion and a second. Would you please call the roll on removing 21-024 from the table?
Niemeyer,
Aye.
Tiltonburn,
Aye.
Wendell,
Aye.
Bacon,
Aye.
Brink,
Aye.
Collins,
No.
Corbett.
Aye. Okay, now entertain a motion to approve Resolution 21-024.
So moved.
Okay?
I'll second.
Okay. So we have a motion and second to approve Resolution 21-024. Any public comment on this one?
Good evening, Mayor Corbett and members of the City Council. My name is Jeanette Gibbons. I live at 1709 Dirdall Drive, Brookings, South Dakota. And we had some introductions before, so I'll get right to my point. I am speaking on the behalf of people looking at our individual rights and freedoms and coming from this at a constitutional level. So I am relying on a Supreme Court decision, the Mac Prince Supreme Court decision of 1994. It's the only time that sheriffs sued the federal government and won the Supreme Court at the Supreme Court level of the United States of America. It was a monumental 10th Amendment case. Federal government was threatening sheriffs to enforce the Brady Bill. They would be arrested if they didn't comply, being forced without negotiating, and they said it was nonsense. They ran it up the pole to the Supreme Court and won. What came out of that was a decision written by Judge Scalia. State legislatures are not subject to federal direction. The federal government is not our boss. The people are our only boss/supervisor. So let's get back to honest government. We do not have a pandemic, or we do have one, but it's not COVID-19. It's corruption from the highest levels in Washington, D.C., and it's filtered down to our lowest levels of government, in my opinion. Do we have the right to make our own health choices? Yes. Do business owners have the right to run their businesses as they see fit? And I also say yes. The propaganda machine and fear-mongering have been very communistic, gutting out small businesses and controlling people's lives. I've seen it at the censorship level with things I do online on Facebook, which I think is ludicrous. The key point about the people as the boss is central to what we're facing now. To my fellow citizens in Brookings, are you being forced to shut down or limit your business? Are you being arrested for not wearing a mask? I hope that one's no. I've managed to outrun the mask police if they're on the loose. Are you having your rights violated by COVID-19 dictators, self-appointed dictators at various levels of government? Sheriffs across America are standing to defend the people. What we wear on our face, the choice to work and provide for our families, the choice to keep businesses open and manage as the owner sees fit. The efficacy and benefit of a law does not make it constitutional. You can give all the statistics and talk all the hyperbole of vaccinations or wearing a mask, but the question is, does government have any authority to do any of this to us? And if they do, is there anything we can do about it? Government cannot make those choices for us. The business of the government is to protect our freedoms. We were given unalienable rights of life, liberty, and the pursuit of happiness. It's the business of government to protect those.
Okay, your time is up.
Thank you.
Okay, anyone else care to speak to this?
Bradley Walker, resident of Brookings. I urge you to pass Resolution 21-024. You continue to push the false narrative that masks stop the virus. When I and others have provided scientific proof they don't, you fail to prove otherwise. You just continue to say, we know masks work. Why? Because you say so? You continue to use fear and emotion to try and persuade people to follow your narrative. Ms. Bacon used the heartwarming story of her visit to Colorado where everyone wore masks inside and out, and it was no big deal. What she failed to mention was the reason for her visit. She went there to care for her mask-wearing daughter who had caught COVID. If masks worked, how did she get infected? Mr. Niemeyer said, 1 death from COVID is too many. 35 is extremely high. How can we not do all that we can to keep those we have safe? I would say the death of 1 business is too many. However many we have lost is extremely high. How are you going to explain to the business owner who lost their life savings due to your overreaching practices that it was for their own good? Then you used emotion by saying, think about the other people in this room you are responsible for. I'm not responsible for anyone's health, just as they are not responsible for mine. You can't spread something you don't have. Besides, if you're wearing a mask, you are protected because masks work, right? I have stated from the beginning that the thresholds you set to get back to normal were unachievable. And then when, lo and behold, they were achieved, you refused to accept the fact they were and created false data to prevent from moving forward. You refused to accept the data from the Department of Health website and used data provided by the Brookings Health System, which is owned by you. Hardly impartial. In fact, when asked which data was correct, Mr. Merkley said he would defer to the DOH numbers. In your video presentations, Ms. Spector has repeatedly provided false information and speculation. These facts have been made aware to council members numerous times. She continues to use words like could, maybe, if, possibly, might, and may have. In one of her latest updates, her slide said was, but she verbally said is, completely misleading. As far as the variants go, she claimed they are more contagious. So in the 3 months since they magically appeared, there have been 2 confirmed cases in the state. Both cases fully recovered with no hospitalizations. Again, pushing the fear narrative. So I would say to end all mask mandates and restrictions and let businesses make decisions on their own. You are here to serve the public, not to push your own narrative. Can't believe I got that all in. Thank you.
Okay. Anyone else care to speak to this? Again, to
Hi, my name's Cole Sartell, Brookings resident, 22nd Avenue. First off, I'd like to thank you all for everything you've done during this time to keep us all safe and for your dedication to peer-reviewed science and facts. I would like to thank the mayor, Nick, Patty, and Holly who replied to my feedback that I sent in about a week ago. I am in favor of removing the capacity limits for the businesses in town, but that would be to keep the mask mandate in effect during that time and actually enforcing it, at least until through May when President Biden says all adults should be eligible for the vaccine, in my personal opinion. That is all I really have to say, but one last thing I would like to add is if you really want to make a difference for our community, if you really want to help our small businesses, you want to help people get back to normal, you're going to wear a mask. You're going to do everything you can to keep your community safe so we don't have to keep these stupid things on our face anymore, because I'm just as sick of it as everybody else is. But we have to do this together. Again, I thank you for everything you guys have done to keep this community safe so far.
okay, thank you. Anyone else care to speak to this? Okay, oh, Dr. Heeb?
Rick Ebe, medical doctor, retired. This is a tough issue. It's really brought a lot of division and a lot of questions, and I'm sorry it's done that. I'm a member of the Academy of Family Practice. By our nature, we are not political. We care about the health care of people, and I think that's what medicine has been speaking to. We have a problem here that some people feel that this is an infringement on their individual rights. And it's tough because you don't want to infringe on individual rights, but society has rights as well. And when somebody does something that doesn't harm them but harms someone else, that's a problem. That's why we have police. That's why we have fire departments. If we all were perfect people and did the right thing on our own, we wouldn't need any of that. At this point in time, we have 2,300 people that are awaiting their second vaccine. These are high-risk people. We need to bide our time a little bit and get those people vaccinated. I'm anxious to get rid of the masks. I've been wearing masks for years, no more so than this last year, and no, it hasn't killed me, and I haven't developed lung disease. So there's a lot of stuff out there that I'm tired of hearing. A lot of our healthcare people are getting really burned out. And if you want to talk about stress, I understand there's stress in the business community, but there's a whole lot of stress in the healthcare community right now. There's a lot of people that I'm afraid, are going to burn out. And they are feeling that there's a segment that doesn't care about what they do or about their efforts to help the public. I would ask that we try to hold on for one more month. We get those high-risk people vaccinated and more people vaccinated. Once we get that done, I think we can certainly ease up on things. If we feel that we can decrease get rid of the limits on people, that's up to the council. I would not oppose that. But let's continue to try to do everything we can to protect other people. Thank you.
Thank you, Dr. Peeb. Anyone else care to speak to this resolution? Seeing none, council comments or questions? Councilman Collins?
Yeah. Is Dr. Spector on or no? Dr. Spector, I just have a question for you. It has to do with the MMRW model that you talked about in the newspaper.
Yep.
Was that off of actual numbers or predictions? I think we all received this email about the numbers that were off a little bit, or actually quite a bit. So I'm wondering if yours were actual or predictions.
The line that said observed were the actual numbers, and the line that was labeled predicted were the predicted numbers, both with the mandate and without the mandate, based on the number of cases prior to when the mandate went into effect back in September.
So can you tell me what the difference was between the actual and the predictions?
Let me look it up. So for Brookings County, it would have been predicted that 100 days after the mask mandate went into effect, if there had been no mask mandate, there would have been 15,007 cases. That's the estimated number. Predicted with the mandate was 4,009 cases, so about 11,000 fewer cases. And we actually had about 2,800. So we fell much closer to the line that was predicted with a mandate than what we would have experienced estimated on that model if there was no mandate.
Okay.
That was for Brookings County. You want the South Dakota estimate?
No, I was just looking for Brookings County though.
So if you have that graph in front of you, and I don't know if you want me to project this or...
No, that's fine. That's fine. Thank you very much for...
The observed is the bottom line. The next line up is predicted with the mandate, and then the one with the sharp increase is what would have been predicted with no mask mandate.
We done?
No, I'm not.
No question?
No, I'm done with the questions. for
Okay.
Dr. Spector.
Thank you, Dr. Specker.
Yeah, thank you. I appreciate that. I think everybody who knows me knows that I'm for not mandates, but just telling everybody that, hey, this is what we suggest. We suggest you do it. I don't think we can look at businesses and say, well, it's just a business. You've been through a lot in a year, but I understand the role between the doctors and also understand businesses as well. The economic impact is pretty huge here in Brookings, I think. And I think we do have to consider that. We have to think about that quite a bit. We have to consider these people that have families and have lost income, and I understand people have also lost lives too. So I get both sides of it as well. I mean, I do. I'm not trying to argue with you about that. I'm just saying. Yeah, exactly. I mean, so have a lot of people. A lot of people have lost jobs. They've lost their income. Lots of people who were having a family have no money anymore. That's what I'm looking at. I think it's easy to make it just say, hey, not mandates, but say this is what I think you should do. People that wear the mask are still going to wear the mask. I'll probably still wear mine. I don't know yet. Depends on what's going on. But the number of people that also have been vaccinated, the high-risk people, that's like 80. I think that last chart we had last week, I think it was up to 80% of people, if I remember that right. But I just think we have to take a look at everybody, and I think, like I said, people are going to do what they're going to do. I mean, this last weekend downtown, with pub crawl, people were walking all over the place without masks. Anyway, that's all I have to say, Mr.
Okay.
Mayor.
Anyone else care to speak to this? Okay.
Could I ask Ms. Specker one more question? Just on Joey's last point there with regard to the comparisons, Brookings County and other counties, how did we stack up to other counties in South Dakota with no mandates in terms of our overall rate of, I guess, case transmissions? What would you say about that?
I've only looked at with the most populous cities, and among those 10 counties, we have the lowest overall rate of COVID cases throughout this pandemic, since the pandemic started. Well, we haven't had the lowest, but we have the lowest now. At the time the mask mandate went into effect, we were about in the middle of those 10 counties. And then during November, when there was such a large peak within the state, we stayed at the lowest level, and we currently have the lowest number of cases overall per population size of those 10 counties.
And I appreciate that, but it's not, if you think that could be due in part to the fact that the demographics of our population in Brookings County are likely quite different from the demographics in those other counties, given that we have a much younger on average population here in Brookings County due to the university. Could that factor into those rates in some way?
Be in a conservative manner. The 20 to 29 year age group, which is what you see at the university, actually has the highest infection rate of all age groups in the state. So it would have given us more cases. You would have expected more cases in Brookings County than you would in those other counties.
But maybe not more cases that would be severely dangerous. I mean, I think we know at this point in time that those who are maybe going to succumb to this illness tend to have underlying conditions and have risk factors that the young population on average doesn't have, right?
No, not a positive case.
Right, I was saying about the danger of that case, yeah.
I think that and I'm sure that other people, the medical community would be happy to comment on this, but I think that what they would report is that there are a significant number of long-term COVID or the long-haul COVID effects that are being seen in the younger population in that 20 to 29 year age group.
Okay, thank you, Dr. Becker, and allow one more public comment. If you want to speak.
Hi, I'm Patty Dexter. I'm from Brookings. Is she a doctor?
Mm-hmm.
Can I ask her a question?
Sure.
Is she on?
Should be, yep.
Are you on?
Yes, I am.
Okay, thank you. I have one question. How many cases have you got that's just a plain ordinary stupid flu? How many cases do you have that reported? For the simple reason, it's not all COVID. There is flus, there is colds. I have been going to a hospital and everything. You know what? I got to the point where if you're pregnant, COVID did it. I mean, there's colds, there's regular 3-day, 7-day flus. What's the difference?
We have Dr. Heeb.
These are cases that have been confirmed through tests, molecular testing, and I'm sure Dr. Heeb would be more than willing to address the difference between a common cold and COVID and the flu. But it is significant differences. This is not the cold and it's not the flu.
The reason I'm asking is I was in direct contact with 3 people, and one got kicked out of their house because nobody wanted them because of the COVID. Everything was tested COVID. I think it's a phony. It's fear. It's a fear factor, and you guys are pushing it. I'm not afraid of it. I think you doctors and nurses are exaggerating the circumstance.
Now, hold it. You got to decide. Are you going to keep talking, or do you ask, and then Dr. Heeb's willing to come up and speak to this topic, or what?
I will stop.
Okay.
Did you want to answer the question?
Dr. Heeb's coming up to speak to the question.
When, Dr. Heeb here again, when this started, we tested everyone for COVID and influenza because we knew that they looked similar in many cases. Now, these tests are very specific. COVID is COVID and nothing else. Influenza A and B is influenza A and B and nothing else. And we have other specific tests. So when we get a positive, we know what it is. Interestingly enough, in South Dakota this year, influenza has been virtually non-existent. My data is not completely up to date, but I believe 2 or 3 weeks ago, at the peak of influenza season, the state of South Dakota had 69 confirmed cases in the state. Now, you can decide whether masks work or not, but usually we have about 1,200 per week on that week. Influenza was non-existent this year. We test for it.
Thank you. Okay, we're going to close public comment. This could banter all back and forth all night. Ma'am, why don't you take your seat? Okay, council, anything else?
I would just like to clarify, before you tonight, right now is the resolution, and the motion is to approve it. Staff's recommendation is to table it till April 30th, but if you do approve it, then the current mandates are null and void then. This would just become a recommendation.
Okay.
Want to clarify that.
Okay.
Mayor Corbett?
Yes.
And perhaps protocol, but I would like to request that we table this resolution until that April date, given the ordinances that we'll be addressing following this resolution.
The specific date that you're referring to, Holly, would be April 30th?
I believe in the staff recommendations, it was April 27th. I believe that's the night of the scheduled council meeting. Is that correct?
That is correct, yes.
All right. That would be,
so I would go with the April 27th.
that motion would be in order, if there's a second.
I'll second that motion.
Okay, we have a motion and a second. table Resolution 21-02 meeting. Council comments or questions? Public comment?
So,
Oh,
this is just for clarification. So if we vote on this, this is a yes or no to pass the ordinance. This is a yes or no to table it.
That's correct.
So we're not going to vote on whether or not to do this then?
If the motion to table is approved, then the consideration of the resolution would be terminated for tonight,
Okay,
and it could come back then on the April 27th meeting.
thank you.
Bonnie, please call the roll.
Wendell.
Aye.
Bacon.
Aye.
Frank.
Aye.
Collins.
No.
Corbett.
Aye.
Niemeyer.
Aye.
Tilton Burn.
Aye.
Okay, this resolution then is tabled till April 27th meeting. City Manager, you want to speak to 21-12?
Yes, Mayor, City Council members, Ordinance 2112 continues the existing mask and occupancy regulations. This includes the requirement of mask for employees at bars, restaurants, salons, as well as 50% occupancy in certain businesses. At the March 16th meeting, City Council did amend this to end April 30th. Tonight, a second hearing will be held for possible council action. Staff does recommend denial of this item based on favorable case conditions, thresholds, hospitalization, and increased vaccinations, and in support of the 2113, which will be heard after this.
Okay, at this time, entertain a motion to approve. This is going to die due to a lack of a motion. Correct, Steve? Okay. And then we move to 21-013. Okay.
Thank you, Mayor, City Council member. 21-13 enacts the regulation requiring masks only in public and private indoor spaces where 6 feet social distancing cannot be achieved. There is still a requirement that employees in bars, restaurants, and salons do have to wear masks. However, the ordinance does transition all occupancy requirements to recommendations. At last week's meeting, City Council did amend this ordinance to end April 30th. Looking at the existing vaccination timeline, Brookings County vulnerable populations will have the opportunity for a second vaccination by mid-April, with full inoculation occurring by the end of April. City staff does recommend approval of 21-13 as written.
Okay, thank you. Council, entertain a motion to approve 21-13.
So moved.
Second.
We have a motion and a second. Any public comment to this one? Dr. Meyer?
Thank you for listening tonight. You've all received an email from me, so you know where I stand, but I just wanted to let you know that I stand with Dr. Heeb in his opinions going forward, and wanted to just make one other comment. People that are not here tonight to support this, there's hundreds that have been working at the vaccination pods that support this, and the people who have been standing there for 8 hours a day to vaccinate our community have come together to help end this pandemic. And so I just wanted to state that and thank them for doing that. Thank you for the science, because we're all in this together to wrap this up. And as Dr. Heave said, we're very close to that finish line. Thank you.
Thank you. Anyone care to speak to?
Hello, Bill Alstalker, Brookings. I sent the council an email and some of you responded, but it doesn't seem like we have answers yet on what I emailed about, which was basically how we're doing so far among lower income people, and then what can we do to make sure more of them are vaccinated, because I think some of the people that like come to Feeding Brookings don't keep a consistent phone number for a long time, so they may be harder to get a hold of. Some of them don't have reliable internet, aren't able to see things that we post on the internet about Feeding Brookings and things like that. So I'm just a little worried that not everyone is being reached. And especially, I think you'd already pretty much have to have your first shot, if it's Moderna and Pfizer, to be fully vaccinated by the end of April. So I am worried about those people, and I'd like to see the data, and I'd like to hear what's going to be done to reach those people. I will mention one other thing on data. There's a lot of talk about our businesses. I'm not real clear what the data is on our businesses, so I'd like to hear more than just anecdotes on that. How many businesses actually have closed in the past year versus, in previous several years? So is it out of the average or not? And what other things we could look at, like I know there's a sales tax number, but I guess I'd like to see more of that on the data of what actually has happened this year, for none other than to know what happened, because I don't think we really have a full finding on that. Thank you.
Yeah, thank you. Maybe we can find that, but not at our fingertips, but see if we can work with the helpline or the United Way and maybe find some of that information.
Yeah, and I apologize, Bill, for not responding to you sooner. I have communicated with Heidi at United Way, and we also have that Brookings non-for-profit group that meets quite regularly. And I've asked to go ahead and continue to share that information amongst all the non-for-profits, so we are communicating that. You're right, not everyone has access to the internet or telephone, but anecdotally, I know that she was telling me that she has been working at some of those food insecurity lines, and she says that she sees a lot of people coming across with those stickers saying, "I've gotten the shot." So we know some people are receiving it, but we still have to do our part to do as much as possible, get that information out. So appreciate you bringing that to us. I'll continue to have those conversations with Heidi.
Thank you. Anyone else public care to speak to 21-013?
Bradley Walker, resident of Brookings. This ordinance should not even be considered because it is discriminatory against certain employees of certain businesses. Again, you are picking and choosing on what they think best instead of relying on science. You want to make restaurant employees and salon stylists and barbers wear a mask, but not the workers at Walmart or Lowe's who are out in the aisles at the store interacting with customers in a much closer proximity. Not to mention that they are stocking shelves, and are handling and breathing on products, potentially contaminating them. There are other reasons why, as I stated earlier, this ordinance should be considered. From the beginning, you claimed the restrictions were to keep the healthcare system from being overwhelmed. Currently, there are no hospitalizations in the Brookings healthcare system. Haven't been for 2 weeks. The next claim you had was to protect the vulnerable population. With the majority of that population now vaccinated, it would seem that need no longer exists. There have been 37 deaths overall since the beginning of COVID. The first one was in August. All the others have been after the mandate was passed, in September. There were 30 deaths at the end of 2020. If you take those 30 deaths divided by 4 months of 2020, when they occurred, you get an average of a little over 7 deaths a month. Now, if you take the 7 deaths in 2021, all divided by the 3 months, you get an average of a little over 2 deaths a month, substantially lower than 2020. With deaths down and hospitalizations almost non-existent, it's time to remove all restrictions and mandates and get back to normal. In case you weren't aware, the vaccine doesn't prevent COVID, it just lessens the severity of the symptoms. And the test positivity rate, according to the DOH website for Brookings, is at 2.9%, not the 7 that you just stated. Not to mention the fact that both North Dakota and South Dakota have achieved herd immunity, a fact that has been provided to you multiple times, and you have yet to provide any evidence to the contrary. It seems to me that you want input from citizens, but you don't listen to what we say. You only go to pursue your own agenda. So it seems to me the only way we will get out of this mess is to remove the incumbent seeking re-election. So vote for me and let's get started to take Brookings.
Hold it. You cannot be using that as a campaign.
I just have a quick question on this mandate. Let me know if I'm out of bounds coming up the second time. Does this have an end date? Or has it been considered?
Yes, right now it's amended to end April 30th.
Okay, then I definitely weigh in favor of this, along with keeping masks and dividers in public spaces with the end date of April.
Jeanette Gibbons, Brookings, South Dakota, 1709 Dirt All Drive. And I'm just going to continue with my statements. I feel that we are being trampled on by what our government is trying to do to us and what they have done to us for the past year. We have individual rights and freedoms. The business owners have individual rights and freedoms. They have the right to run their business, and if they're not hurting someone else, we don't have the right, or you don't have the right, to stop them from providing for their family, employing others in our community, providing a service. So if people are so threatened by going to the businesses, and they have this limited number of people that can come there, then don't go there. I honestly could live in my own home, I think, year-round if I wanted to. I could have Walmart deliver to me. I could call Hy-Vee or place my order online and just stop by and have them chuck my bags into the back of my van. So there is no reason for these businesses not to be open. And government has overreached. I'm going to go back to my Sheriff Mack, and I think my next step would be to pursue legal avenues. I'm not a business owner, but I see what's wrong. So the question is, does government have any authority to do any of this to us? And if they do, is there anything else they can't do to us? Government has become so capricious and has become so unconstitutional that no one who understands and has studied our foundation could ever recognize what we have today in our government. This is what our government, you are telling us. You will have individual rights and your civil rights unless there is an emergency. And we will be more than willing to sacrifice your individual liberty, your constitution, your well-being, God-given liberty for you. No, that was never meant that government could say, as long as there is a crisis going on or an emergency, and we can take all of that from you. No man can take away our God-given freedoms. These are gifts from God, not from government. No man, no woman is allowed to take these God-given rights away from us. In the words of Justice Scalia, going back to the case of Mac Prince against the federal government, but the Constitution protects us from our own best intentions. Now, I don't know if you had set about with these rules as best intentions to protect me. I can protect myself, I can protect my family, and I will not endanger others. If I'm ill, I'll stay home. I won't cough, sneeze, or otherwise infringe on somebody's personal space. Your job, government, city council, is seen in the Declaration of Independence. Your job is one and one only. To secure these rights, governments are instituted among men. Your job is to protect our God-given rights. Power is divided among the branches of government so that we may resist the temptation to concentrate
Okay, your
power.
time is up. Okay, council, any comments or, oh, you have one more person?
I have a comment on the mask mandate, period. I think it should be removed because one thing, you have people who have asthma like me and go to the clinic and they tell you you have COVID. But they test you and then you don't. We should have freedom to have a mask, not wearing a mask, because I break out from them, for one. For two, also we should be able to breathe without them over our face. The other thing is you have people like your South Dakota State students running through buildings, shopping without a mask. Do they catch COVID? No. Another thing I have to ask you is, how many COVIDs have you had since we had the mask? You still have COVID when we had the mask. People are still getting sick of COVID. You're not stopping it with the mask. You're still getting COVID. You're still being tested for COVID. My question is to you guys is the mask really doing anything if we are being tested for it and we don't have it? No, not really. So that's why I asked you to remove it, because I also work for Lowe's, and I see people coming in every day without wearing a mask. Our employees all wear masks. They get tired of it because people can't breathe. They can't talk to their customers because it's like screaming at your customer, and it's not right. And there shouldn't be a mask mandate. You should have a right of your own to not wear a mask. And that should be right of each and every one of you. Even if you're a lawyer, you're a doctor, or a nurse, that should be your own personal right. And you shouldn't have a mandate saying that you have to wear this mask because I told you to. Going back to this lady, I do agree with her because we're still getting COVID no matter if we're wearing masks. Even if we're getting shots, there's still people out there that are wearing masks that are still getting COVID. And like I said, I do agree with her. I really do. And I think it should be lifted all over. Thank you.
Okay, council, any other questions or comments? Councilman Wendell?
I would just want to make a couple of notes around ordinance 21-013. First of all, I want to say thank you to the dozens and dozens of folks across the community that we heard from in the last week. When we gathered together last week and we laid out really three options: a resolution that would move all of the existing mandates to recommendations, the continuation of 012, which would keep the mask mandate and capacity limits in place, or this ordinance that we're considering now. We heard from a number of people in the community, and the overwhelming response was that the members of our community were in support of a mask mandate. Many of them also were in support of continuing the capacity limits. But what I took away from the conversation and what we're learning is certainly that the mask mandate is still in the appetite of the majority of the members of our community. I also want to go back several months, not to relitigate the conversations we've had, but just to remind ourselves that we knew that when we instituted a mask mandate in September that we were never going to bring the number of positive cases in our community down to zero. That, of course, would be a unrealistic goal. Our goal was to slow the spread of COVID-19 in our community, to decrease the number of positive cases that would ultimately become hospitalizations. All statistics tell us that we have done that in Brookings County. We didn't eliminate COVID in Brookings, and that could never have been our realistic goal. But we were hoping to put very reasonable actions in place that could get us to this stage, where the vaccines were more readily available. We were getting close to the end of the academic year. We were hearing from the Brookings School District and South Dakota State University that they were able to host things like in-person graduation receptions, that we were planning for a fall that might include in-person SDSU football games, all of the things that we know are an important part of the culture of this community. I don't think any of us want to continue wearing masks in perpetuity. That's why we've put a timeline on the extension of this mask mandate. I do believe that we're seeing an end, a light at the end of this proverbial tunnel. But I think that our masking efforts in Brookings have worked thus far, and I'd like to see us continue them until a larger percentage of our population has received the vaccine. I also want to note that now would seem like, as we're approaching what we hope is the end, a huge thank you does go to our healthcare community. And I don't know that we spend enough time in these conversations thanking the folks on the ground in our community that I know are exhausted. But I also want to thank our business community, because I think there has been pain that has been felt in our small businesses in this community. And never have I made a decision here that has diminished that pain. And I know this council collectively always considers what the impact might be to businesses in our community, which is why we came to the place where we said a masking mandate makes good sense over the next couple of weeks, but now would seem like an appropriate time to lift the capacity limits. And I hope we're right. All indications are that this is a reasonable path forward. And that's why I'm voting in favor of 013 tonight.
Okay, thank you. Any other Councilman Niemeyer?
So I did some quick math today when I was taking a break waiting for my truck to get its oil changed on 012, 013, and the recommendation one. And in my math, we came up with 32 people in favor of the 013, 31 people in favor, and then add a few couple comments tonight to 013 for about 33 people, 33 responses, and then a total of 11 that just wanted the recommendation. So basically 3-1. And I asked for it. I asked for the public to chime in. I wanted the public to let us know what they wanted. This isn't all just our decision up here. This is the public safety of the community, and the community makes the decisions as far as I'm concerned. So I will be voting in favor of this. I know there's probably going to be some restaurants and businesses that will still require a mask in their business and require a certain amount of capacity. I think those businesses still should be recognized that they're trying to do the best they can for the clientele that they have coming in, because the clientele that goes to those stores feel safe that way. And then obviously we're going to have a few of them that are going to go wide open, and that's fine. But God help us if we go the wrong direction on this.
Councilmember Bacon.
I just want to follow up with, in support of increasing our vaccinations. And one question I have, Dr. Heeb, I know we're putting you on the spot a lot tonight, but do we have any data supporting how many COVID cases we have found who were completely asymptomatic?
Dr. Heeb, could you just come up to the microphone, please?
Not to my broken down, but obviously that's one of the problems with COVID. You can run around for 4 days having COVID and not be sick. And then you get sick, and then people come in and get tested. So, you know, how many asymptomatic people are running around out there? I don't know. You know, I've been vaccinated, but I still potentially have a 4% chance that I could have COVID right now. And I could spread that to anybody if I'm not careful. That's the best answer I can give you.
Okay, thank you.
Okay. Councilmember Tilton Byrne, did you have any questions?
I don't have any questions, but I do have just a couple of sentiment that Councilman Niemeyer stated. I also did the math on the comments that we received between last week and the start of the meeting today, and I got that same number of about 3 to 1 in support of continuing masking. So I think that really shows that the community does want to continue to see masks happening for the time being. I think that the ordinance that we are voting on now is a nice step in the direction of hopefully seeing the light at the end of this tunnel, in easing restrictions and not removing all of them completely. And I do want to remind our community that with this ordinance, if it passes, it does still have recommendations for those occupancy requirements. They're no longer mandates, but they are recommendations. And I think one of the things that the community should really consider is that some places may still have those requirements in place. And if you find yourself in one of those businesses, I think it would be in order to ask that be respected, and that we understand and have a little bit of grace with each other, and understanding that we're all trying to navigate this the best that we can, and come up with the best compromises as we continue to figure out how to navigate this pandemic.
Okay. Council members, any other?
I'm sorry, I don't want to belabor this. I just, Councilperson Tilton Byrne just gave me something I do think it's important to emphasize, and we'll probably emphasize this multiple times over the next couple of weeks. I think, I don't know if you all feel like I do, I feel like COVID came upon us very quickly, and we all had to change our behaviors very quickly. We got used to wearing masks quickly. We embraced these behaviors quickly. I think the road out of COVID will be trickier to navigate, and I do think it'll require a lot of grace as community members, where we will see certain folks change behaviors. They may be vaccinated, they may not. I mean, I would just remind folks that the next couple of weeks and months will be harder than it was last year at this time, because we all moved in one direction together all at once, and we may trickle out at different times for different reasons, and I think we need to show each other some grace in the next couple of weeks and months.
Okay. Bonnie, please call the roll on ordinance 21-013.
Brink.
Aye.
Collins.
Aye.
Corbett.
Aye.
Niemeyer.
Aye.
Tilton Byrne.
Aye.
Wendell.
Aye.
Bacon.
Aye.
The ordinance 21-013 is approved. Call on City Engineer Jackie Lanning now. And Chief Erickson, it looks like, so.
Thank you. Mayor and City Council and audience at home, we're understanding there's or should I wait for the motion? I apologize.
Oh, okay. No, I guess for this one, we do open and close the public hearing, and then we'll go to a motion, so, sorry.
Okay, thank you. I understand there's a reconsideration of ordinance 21-004, which was setting the speed limit on 20th Street South between Western Avenue South and Main Avenue South. And I wanted to describe a few things related to the street design of this area. 20th Street South, the street classification is determined before a street is designed. And I included a map in the packet here showing several of the arterial streets and collector streets in this neighborhood. Streets highlighted are arterial streets except for Western Avenue, which is a collector street. And the 20th Street South, the entirety of it, was designed as an arterial street, so it was designed for 35 mile an hour of traffic. And what that means is we set a certain pavement width and the striping of the lanes, and also the vertical curve of the road is set to match highway design for 35 mile an hour roadway system. And so the vertical curve on 20th Street South was lowered about 4 feet vertically, or it's vertically lower than the previous road section. And we did install pedestrian crossing signs near the Larkspur intersection along the roadway system. And another factor that played into the design of 20th Street South is that it is about a half a mile north away from 26th Street South, where Dakota Prairie School is. And so we felt like it was, being that half a mile of distance, that we had quite a length of roadway away from the school zone area. And it is similar to many of the other streets in this area, and I just highlighted the map showing the other 35 mile an hour road systems. Madera Avenue happens to be narrower in the section that's highlighted in pink, which is why it's only 25 miles per hour. And I hope this information maybe provides a little clarity on how the roadway system was designed, and then Chief Erickson's here if we have any questions about the traffic issues.
Why don't we go ahead and get a motion to approve ordinance 21-004?
So moved.
Second.
We have motion and a second. Okay. Any questions? Anybody in the public here to speak to? Okay, council comments or questions? Councilman Collins?
Yeah, this was my recommendation. After hearing some things that I wasn't quite sure of before, and after talking to Chief Erickson also about that there hadn't been any accidents in the area, the hill that I was concerned about had been cut down 4 to 5 feet. Is that right?
Yes.
Okay. The road was actually made for 35 miles an hour. And the people that have contacted me have told me that that road is just not very busy. The school, K through 3, is far enough away, and I can't imagine at that age, well, at least I wouldn't allow my kid to walk across the street alone, the K through 3. Not sure that would be everybody, but that would just be me. I would walk my kid across that road at that point. But with all that said, and with all the information that you guys gave me, I really appreciate that I will vote yes for this.
Councilman Wendell?
I was also a no vote last time we considered this issue, but I've appreciated staff reaching out and giving us some additional context, and members of the neighborhood that are very familiar with traffic patterns in that area have also reached out, and so I feel more comfortable today than I did a couple of weeks ago voting yes to increase the speed limit.
Councilman Niemeyer?
So, Jackie, I voted yes for this. Discussed, a flashing sign. Would a study justify that? I know Paul doesn't like us to think about putting in stop signs or warning signs just because of the legal ramifications of it. But if we did have a study about the crossing there, how would that study be done, and what would justify having a flashing sign there?
We will do a when students are walking, or pedestrians, I guess it could be any adult or children.
Okay.
And then we'll look at
I'm sorry, Jackie, what's the magic number?
It's an all-encompassing study.
Okay.
There's not really a magic cutoff where it's 10 persons per hour or anything like that. It's, you look at your volume of traffic, how many people are crossing, what time of day, how often, and then you perform an engineering study, so there's some judgment behind it. It's not a one-size-fits-all type of study.
Yeah, because I saw an example somewhere in Sioux Falls when I was doing some measuring, and I saw the flashing sign, just a crossing sign that was either before or after it, I can't remember. But I think the flashing sign was first to give you a quick jolt to say, yep, there's something coming up, and then the next sign was there real close to where the crossing was. So I just kind of visualize that. If we do have to go to that, I kind of visualize that's what we'll have to see.
Okay. And I can sure follow up with data, perform those studies.
Thank you.
Any other council member have questions or comments? Bonnie, please call the roll.
Collins,
Aye.
Corbett,
Aye.
Niemeyer,
Aye.
Tiltonburn,
Aye.
Wendell,
Aye.
Bacon.
Aye.
Okay, ordinance 21-004 is approved. Thank you both. Time. Okay, then we'll talk about ordinance 21-006 and Community Development Director Mike Struck.
Thank you, Mayor, members of the council, and audience at home. Ordinance 21-006 is an ordinance proposing a rezoning of two properties along 6th Street at 1402 and 1404 6th Street. They are currently zoned to Business B-2A, which is an office neighborhood type, proposed to be rezoned to a B2. This is part of a urban strategy area within our comprehensive plan. This is something that when we were going through that comprehensive plan update, we anticipated that 6th Street would change over time. And so the applicant brought forward a proposal for the rezoning. It is surrounded by R2 zone property to the east, which is the Hillcrest Aquatic Center. To the south is a residential neighborhood, also zoned R2. To the west, next door, is a B2A, and then it's 6th Street to the north, and then on the north side of 6th Street is B2 zone property. This does come to you from the Planning Commission with a 7-0 recommendation of approval. It is consistent with the measures of promoting economic development, retail, commercial, industrial, and tech development as part of your 2018 to 2023 strategic plan, and I would stand for any questions that you may have.
Okay, thank you. Council entertain a 006.
So moved.
Second.
Any questions? Okay, stand by for public comment. Come on up. Jay, if you'd introduce yourself then and like that.
My name is Jay Larson, and I'm a resident of 1347 5th Street, and also a property owner of the adjoining neighbor, which was a one-owner house, and that's at 1353 5th Street. We are adjacent to where it has been, this rezoning has been requested. In reference to Director Struck, I think that in my email from the 21st, it said that you can interpret a comprehensive plan and the strategy of land use many ways. And when I read it through and provided you copies of detail in my email, that shows that it was interpreted differently. For instance, the goals of those that were put out in the strategy plan were very specific. When it says economic development, it's a very general. So things do and are subject to interpretation. The letter I gave you, I'll let you read, but the concern is it is now B2A. There are 6 uses for that, one of which is a office building. 4 The B2, a business, there are 28 uses, and they vary significantly. And then with that, you can imagine what that is like in a neighborhood. You look at 6th Street, it has been changing over time. For those that are long-term residents, I am 42 years. There has been James Dornbush, professor of civil engineering, and he had worked with this, and I have a folder of all the activity since 1950s that has been happening to 6th Street. So yes, it has changed over time. The 7-0 Planning Commission vote was something that possibly could have been viewed differently if all information was known. And regrettably, maybe it wasn't. We are in a society where, of course, bigger is better, maybe. Homeowners change. But I think that it is important to realize that there is a neighborhood, and whatever happens, there are precedents. And with that, on 6th Street or any street, for instance, in the comprehensive plan of 2040, there was the changes of some of the properties, and it was, sorry, okay.
Thank you, Mr. Larson. Okay, any other public comment on this? Council comments? Bonnie, please call the roll.
Corbett,
Aye.
Niemeyer,
Aye.
Tilton Burn,
Aye.
Wendell,
Aye.
Bacon,
Aye.
Collins.
Aye.
Okay, ordinance is approved. Now, have Community Development Director Mike Struck again.
Thank you once again. Ordinance 21-007 is another rezoning request in the Telcamp Industrial Park on the east side of the interstate. This is for 2 lots that are currently zoned on industrial I, proposing to be rezoned to I1. I1R is a more restrictive zoning district. It has different submittal requirements, and it's primarily in place to really protect the aesthetics along that interstate corridor. The 2 lots are located on the east side of Prince Drive. They have I-1 zoning to the north and to the east of them, and they are a considerable distance away from the interstate, albeit right now the land in between these 2 lots and the interstate is currently undeveloped, but at some time in the future, we fully anticipate that development will occur. This does come to you as a 7-0 recommendation from the Planning Commission to approve, and I'd stand for any questions that you may have.
Council entertain a motion to.
Second.
Any public comment on this? Council comments or questions? Please call the roll.
Niemeyer,
Aye.
Tilton Burn,
Aye.
Wendell,
Aye.
Bacon,
Aye.
Collins,
Aye.
Corbett.
Aye. Okay, that's approved. Now ask City Clerk to introduce the request for an on-off sale malt liquor.
Good evening, Mayor and council members. MG Oil purchased the former Gas and More location at 606th Street last fall. They are asking for an additional, which would allow them to put in a Suite B and 10 additional video lottery machines at this location. All required documents have been submitted, and if it is approved and following the occupancy permit issuance granted by the Community Development Department, the application would then be sent to peer both the State Department of Revenue and the Video Lottery License Office for approval. Staff does recommend approval.
Okay, thank you. Council entertain sale malt license.
So moved.
Second.
We have a motion and a second. Any public comment to this one? Dr. Heeb?
This is the Gas and More on 6th Street.
Yes.
That's right across the street from the Methodist Church, if I'm not mistaken. This was attempted once before, and I know that the Methodist Church did oppose this because we have GAP and other programs right across the street that use that combined parking lot. So I think there are some issues that should probably be discussed with the people in the area there before you would consider voting on this. Because I think there are, some questions about having on-off sale alcohol and those types of things in areas where there are a lot of small children right across the street, right across the parking lot, basically. I would ask for that consideration.
Okay, thank you. Looking at legal counsel or city clerk, doesn't that location already have an on-off sale?
Yes, this location currently has 1 on-off malt license and
Okay.
10 video lottery machines. This action tonight would grant them a second on-off malt license with up to an additional 10 video lottery machines, allowing for a total of 20 machines at this location.
I have a question for Steve. So, I guess, I opposed that first one. And I know what happened is eventually the current, or the former owner of it eventually got the video lottery license also. He also already had. Could you kind of explain to the public what happened there?
I think the malt beverage license was approved by the city council, and then there was certainly a lot of debate over the issuance of a video lottery license. And at that time, the law concerning issuance of video lottery was not fully clarified, but subsequent to our initial action, there was a Supreme Court decision, which was City of Sioux Falls, where it was determined by our Supreme Court that cities could only utilize the criteria provided in one video lottery statute, which also includes whether the location is appropriate for a video lottery, and therefore, with that clarification of the law, then the city council did approve ultimately the video lottery license for that location. Now, since that time, there has been a desire to add more machines. We've received some guidance that even within the same footprint of a building, that it can be redeveloped so that with additional malt beverage licenses approved by a city council, that the additional video lottery machines can also be approved. You still have the authority, so it is clear you have the authority to approve both malt beverage and video lottery based on the traditional criteria of whether that is a suitable location. And so all of the considerations, and I said the same thing probably back when we talked about it the last time, is that you can evaluate all the facts, hear the public comment, and decide whether or not that's a suitable location, even though you may have granted the approval previously as to the original malt beverage and video lottery licensing.
Okay, thanks, Steve. Councilmember Bacon?
I've been on record not being thrilled with continuing to increase the number of these machines, and that we just don't have any control over it, I guess. So I will be voting no, but I would be surprised if it failed.
Councilmember Tilton Burn, did you have any questions or comments?
This time.
Councilmember Wendell?
I would say that in the not so distant past, we did a pretty deep dive on history of video lottery and what state law allows and how our community has interpreted in the past, knowing that this has been a challenging issue. And that we've been confronted with this type of decision lots of times in the last couple of years. I'm not saying that because we approved it in one location, we just have to continue to follow that exact same path, but it is hard for us to determine what the criteria for not approving this location would be, given that in the not so distant past, we approved it elsewhere, not all that far from this location. And so I think that the information you were able to provide us a couple of months ago was instructive for me and helped me kind of build my own perspective on how we handle these requests. And so whether I have personal discomfort with the continuing multiplication of video lottery machines, I'll be voting yes on this one.
Any other comments, council? We need to vote on each one separate, don't we, the malt and then okay. Bonnie, please call the roll on the on-off malt license.
Tiltonburn,
Aye.
Wendell,
Aye.
Bacon,
No.
Collins,
No.
Corbett,
No.
Niemeyer.
No.
Okay, now, video lottery question. Bonnie, anything, council? Bonnie, please call the roll on the video lottery.
And I think that technically it has to be licensed for malt beverage.
So it just falls
Correct.
off because we did.
Correct. It
Okay.
wouldn't be suitable for a motion at this point in time without the approval of the malt beverage
You said
license.
it would not be appropriate?
Would not be.
Okay.
Correct.
So this just died due to the previous action. Okay. All right, under other business, Community Development Director, here he comes, Resolution 21-025.
Thank you once again. Resolution 21-025 is somewhat unique in that it would be a resolution vacating Lot H1 in the Township 110 North, Range 50 West, which is the same location as along 22nd Avenue, and it's the small little corner of what would be Lot 4A in the Americana edition, so it's where the H1 is. Best we can tell is 40-plus years ago, there was an idea of a potential street needed in this area, and they went to the adjacent property owners, and they were able to secure a 37 by 30 square foot area to preserve for a potential street right away. It never came to fruition. The developer has submitted a petition to vacate that little corner of the in the northeast corner there, that H1 lot. And so the action before you today would be to vacate that H lot and then also authorize the mayor, city manager, and clerk to transfer that particular vacated lot to the adjacent property owner, and then they would replat it and incorporate it into that lot there in the Americana edition. I'd stand for any questions that you may have.
Council, why don't we go ahead and have a motion to approve?
So moved.
Motion and second. Public comment? Council members, questions or comments? Please call the roll.
Bacon,
Aye.
Collins,
Aye.
Corbett,
Aye.
Niemeyer,
Aye.
Tiltonburn,
Aye.
Wendell.
Aye.
All right, Resolution 21-025 is approved. And I'll turn it over to City Manager for strategic plan.
Thank you, Mayor, City Council members. In 2018, City Council created a 5-year strategic plan. Every year since then, City Council reflects on the plan and adjusts it according to the current council and the community needs. In 2020 and 2021, the city accomplished many of the goals from that original plan, including the progression of the overlay districts for major corridor areas, which is going to Planning Commission this month. A new water plant location identified, which will occur at April's study session by Steve Meyer from BMU. Renovation of the Bob Sheldon baseball field, which will have a ribbon cutting here next month, hopefully with sunshine. an update of the city's historic preservation plan, which will be presented here in the next month or so, and then finally the CVB new location there on 6th Street. The new plan was honed to adjust to 5 primary focus areas with statements defining strategic outcomes. These focus areas, which are included within your packet and including the entire plan, include the fiscal responsibility, safe, inclusive, and connected community, service and innovation and excellence, sustainability, and economic growth. New this year was the implementation of summarized objectives that encompasses prior specific projects from the 2018 through 2023. So majority of those items were carried over into this new plan, but really summarized to an extent. Once approved, and if approved by City Council, staff will strategically work towards the 35 identified projects and goals that achieves Council's desires over the next 5 years. Moving forward, all staff memos that are included within your packet will include a new section identifying the 5 key focus areas that are associated to the items brought before Council to ensure we're always working towards achieving these objectives. At the end of April, very excited that staff will be presenting the performance metrics that's based on national best practices for communities of our size, and will include the focus areas, strategically prioritized analysis based on those focus areas. Staff would recommend approval and be happy to stand by for any questions.
Thank you. Council entertain a motion to approve.
So moved.
Second.
All right, motion and second. We've discussed this, I guess, at our retreat and everything. Any public comment on this one? Seeing none, close public comment. Council, any other questions? Please call a roll.
Collins,
Aye.
Corbett,
Aye.
Niemeyer,
Aye.
Tiltonburn,
Aye.
Wendell,
Aye.
Bacon.
Aye.
Okay, strategic plan is approved. Next, here comes the Assistant City Manager, Jake Meschke, the progress report.
Good evening, Mayor, members of the City Council. This is the March 2021 progress report. First up is the 20th Street Interchange project that we continue to see good progress on. For anyone interested at home, we do have a dedicated website. It's on the screen before you at 20thstreetinterchange.com. Please feel free to visit that and see the many of materials that are available, that have become available throughout the course of this project. As of late, the land appraisals for neighboring properties have been completed, and 90% construction plans have been completed as well. Some of the next steps will be negotiating for land acquisition and easements. That will take place from March to June of 2021. During that time as well, we will finalize the project design, and eventually we'll go out to bid for this project yet in fall of this year, and in construction is expected between 2022 and 2023. As a reminder, the combined municipal school district election is coming up on Tuesday, April 13th. I would remind everyone to go ahead and check their voter registration at this time. They can do so by going to www.sdsos.gov or calling the Brookings County Finance Office. Your registration must be confirmed or updated by March 29th at 5 p.m. If not, that can result in a failure to vote or forfeiture of your right to vote in this upcoming election. So everyone would be encouraged to go ahead and verify their voter registration by that date. Early voting will begin on March 29th and run through April 12th at 5 p.m. That does happen on the first floor of the City County Government Center, which is this building. It is available 8 a.m. to 5 p.m. Monday through Friday. As aforementioned, the election day is April 13th. Hours for voting will be 7 a.m. to 7 p.m. Encourage folks to check out the Chamber of Commerce virtual forums. There was one held on March 22nd for the mayoral candidates. The next one upcoming will be for the school board candidates, which will be on March 25th at 6 p.m. And finally, there will be a city council candidate forum on April 3rd at 9:30 a.m. You can register for those events through the Brookings Chamber of Commerce. I encourage anyone to check out the Chamber of Commerce website or call them for additional details. These events are free to participate in virtually, or attend virtually, I should say, but registration is required. For additional information on the upcoming election, I would encourage folks to visit the City of Brookings website, go to the Government tab on the very top, and then select the Elections webpage. Now is the time that we look forward to our spring cleaning. One of the great accomplishments of retiring Director Todd Langland was the opening of our Citizens Campus. The Citizens Campus is open 24/7 and opened up on March 20th of this year. This is an opportunity where residents can take tree branches, flowers, weeds, grass clippings, leaves, etc. to the landfill for drop-off at their convenience. Spring cleaning this year will be held from April 5th through the end of April. On April 5th, residents can begin setting their items curbside in the boulevards. April 11th will be the last day that all items should be curbside, and then on April 12th will be the day that the crews actually start making their way throughout the community. They will do one canvas of the entire community. Updates will be posted through social media for folks to know which areas of town have been completed and which ones are left to be done. As a reminder, please utilize the boulevards, as there will be no pickup in the alleys. Also during the month of April, starting on April 5th, there will be free landfill dumping for residents. Again, it is residents only and it is not commercial haulers. There will be fees for certain items to include tires, refrigerators, and AC units, but all other dumping is free. Residents are encouraged to haul those smaller items to the landfill, as it does make the spring cleanup process go a little bit quicker. As residents may be familiar, during this time we typically also do our pay and exchange program, which is done with the gracious volunteering of our local 4-H. Just with the little lingering effects of COVID-19, we are going to postpone that. We do anticipate a pay and exchange happening yet this year, but would likely target a fall date. More information will be available as we get closer to that event. Anyone who hasn't downloaded our Engage Brookings app would again encourage them to do so. It's available in the Apple App Store as well as on Google Play. The city recently announced an awesome partnership with Brookings Municipal Utilities for streetlight issues. That's one that staff at the city as well as Brookings Municipal Utilities saw we were starting to get some requests for, so we were able to bring some of the staff from BMU on board, and now those requests get routed directly to them and they're able to address your streetlight issues. This could include streetlights being on when they shouldn't, being off when they should be, and if you see flickering or anything of concern, please download that app. It's also available on the city's website, and report any streetlight issues that you come across. We started doing some spotlighting of our various departments. One of the recent ones that was completed was for our emergency 911. It is a video spotlight that really highlights a day in the life of a dispatcher and highlights the services that they provide to our community. There are a number of opportunities on watching this video at the city website, down in the spotlight section, on our Facebook page, as well as the city's YouTube channel. Highly encourage anyone to check out the outstanding services that these folks provide in helping keep us safe. The library held their first book sale in over a year. It was a grab bag sale that began on March 16th. They sold 124 bags on the first day. They're doing a special of $5 per bag or $3 for 10. Those bags will be available through March 31st. They put out new bags daily. As you may be able to tell in the picture, what they do is they sort them by genre, and you get about 10 books or so per bag, and it's just all around that genre, as you can see, like fiction, historical, nonfiction, so on and so forth, where it really tries to target readers' interest with books that they hopefully haven't read before. Solid waste notifications are now available on the city website. On our homepage, there's a Get Notifications tab, and this one will actually be right on the very top. You can get email notifications regarding the landfill, as well as collections for garbage, recycling, and yard waste. Some of these sample updates, if you sign up for them, would be changes to service, which can be impacted due to weather or certain natural events, as well as our holiday hours if we are working around a holiday. Lastly, some may have noticed we had a new fire truck out front today at 5:30 for some folks to see. It is a brand new 2021 engine. It is replacing a 2001 model. Per the National Fire Protection Association, these vehicles should be replaced every 20 years or moved into a reserve status. The new truck that was out front today will be housed at the East Station, which is on 6th Street, and this is one of 5 engines in the city of Brookings fleet. With that, I'd be happy to answer any questions.
Any questions? Jake? Council, looking ahead to the next meeting is April 20th, study session. We'll going to look at the Swiftel Center Economic Impact Discussion, a performance management presentation by Jake, presentation of BMU water treatment upgrade. Park and Rec Department will talk about tree rebate program, and they'll also talk about the park master plan. Anything else coming up on 20th, Councilman Wendell?
Can I ask a clarifying question, or just give us an opportunity to clarify? Ordinance 21-013 goes into effect immediately, correct? So the occupancy restrictions on businesses would be lifted starting tomorrow?
Upon publication, so
That's 3 days, right?
be as soon as we can get it published.
Okay. Can we, I feel like some of our business owners maybe want a little firmer date on that.
Publication date will be this Friday.
So the occupancy restrictions in spirit are in place through Friday. Okay.
Good question. Anything else on the study session? All right. For the media, we'll be going into executive session. There'll be no action taken when we come out. So executive session pursuant to South Dakota Codified Law 21-25-2.1, consulting with legal counsel or reviewing communications from legal counsel about proposed or pending litigation or contractual matters, and for discussing marketing or pricing strategies by a board or commission, by the business owned by the state, or of any political subdivision when public discussion may be harmful to the competitive portion of the business. Council entertain a motion to go into executive session.
So moved.
Second.
We have motion and a second. All in favor say aye.
Aye.
Same sign. We're in executive session.